probably be starting now.
Absolutely, you're good to go ahead. Go ahead.
All right. And I'll just tell you that once I start sharing my screen here, I won't be able to see anything but my screen. So I won't be able to see the chat, I guess, or, oh, I do see people. Okay, well, no, well, we'll see here. Just tell me if I need to know anything. Appreciate it. And hey, thank you everyone for this. Oh, good, I can see things still. Okay. So people can see my screen and me, I take it.
Yes.
Okay, great. Hey, thanks everyone. So Russ Swerdlow here, and I'm one of the co-PIs of the Therapeutic Diets of Alzheimer's disease, or the TDAD study. And this is a study that I'm very enthusiastic about. Something I've been working on for a long time, really 35 years. So this the really important critical things you need to know about this study are listed here. We're looking for people who are willing to engage in a study that requires 4 months of participation. The participants will be randomly assigned to a heart healthy diet or a ketogenic diet, and I'll be giving you some more, background and information about exactly what all this entails. And our advice is if you're seeing any patients that you think might be appropriate for this study or interested in this study, our message is don't worry too much about pre-screening them. Will they qualify or not? We'll do that part. So we're looking for mild to moderate Alzheimer's disease, but if someone's kind of like on the border between MCI and Alzheimer's, or they have MCI and Alzheimer's biomarkers, we'll take that into account and determine whether we can justify their enrollment according to our inclusion-exclusion criteria. There's a wide age range. Openness to diet changes, that may actually be an advantage in some cases if people are more confident about being in a trial that maybe doesn't require an experimental medication. And people are supposed to have MRI scans in this. If someone can't have an MRI, if someone's kind of on the fence about whether they'll do MRI scans, maybe it's best to let us screen them. And of course, cognitive testing is an important endpoint though, so we need that. The rationale behind this study is pretty simple. So it's been recognized for decades that glucose utilization is reduced in the brains of people with Alzheimer's. We can see that on FDG PET scans. I mean, we've known this since the 1980s. And it's based around the idea that ketone bodies are an alternative brain fuel. The brain loves to metabolize ketone bodies to make energy. So the question becomes, could a ketogenic diet benefit Alzheimer's patients? What is a ketogenic diet? Well, it's pretty straightforward. I mean, a lot of people that have done it, many of you may have done it. It's essentially a high-fat, low-carbohydrate diet. It differs from an Atkins diet in that protein intake is not boosted. So it's not like you're in Atkins, you boost protein in addition to fat to make up for the drop in carbs. But in a ketogenic diet, you just make up for the drop in carbs by adding fat. And what this diet pattern does is it causes insulin levels to fall. And what really makes the insulin levels fall is the reduction in the carbohydrate intake, and the liver, because of the reduction in insulin, will start catabolizing fatty acids into ketone bodies, which will then be secreted into the blood and be taken up by the brain and used as a brain energy source. And we know that this does affect the brain, as this diet has been used for decades to treat epilepsy. And how might it affect the brain? Well, it's probably through multiple possible mechanisms. One is, the very straightforward, obvious one of energy. If you are, can we boost energy levels in the brain by giving ketone bodies or supplying ketone bodies? But also, insulin has effects on the brain. So, by changing insulin levels, that probably has an impact on the brain. Just by the fact that people are taking up or eating more fat, lipids can affect the brain. And the ketogenic diet actually has anti-inflammatory effects. So perhaps reducing inflammation or inflammation signaling may lead to effects on the brain. This is really the one sort of nerdy, basic science slide that I'm going to give. And the reason why it's so relevant to the justification and rationale for the diet, or for trying this diet in Alzheimer's. These are data we recently published in which we took mice, just regular mice, and we put them on a ketogenic diet for 3 months. And after 3 months, we harvested their brains and we enriched their neurons and did something called RNA-seq or transcriptomics analysis of gene expression in their neurons. And we asked the question, what diseases would be predicted to be affected by a ketogenic diet? And interestingly, the disease that rose to the top of the list, you can see the Q value, the significance here, is actually Alzheimer's disease. And the reason being that in the brains of Alzheimer's patients, we see a reduction in the expression of genes that support the insulin signaling pathway and support oxidative phosphorylation. And in neurons from mice on the ketogenic diet, we actually saw an increase in the expression of genes that support oxidative phosphorylation and an increase in genes that support the insulin signaling pathway. So for these reasons, Alzheimer's disease was implicated as a disease that would be particularly impacted by a ketogenic diet. Therapeutic ketosis, going beyond the confines of a diet, though, has a long history. So somehow the ancient Greeks figured out that fasting could had an effect on epileptic seizures. So Hippocrates even wrote about fasting to treat seizures. And you even see this in the New Testament. So, people back in biblical times had the same realization that fasting affected seizures, which I guess they called fits. And they reasoned that these fits were being caused by demonic possession. So if you fasted, then you starved out the demons, and that's why people stopped shaking. And then, so in the 20th century, early in the 20th century, it continued to be appreciated that fasting caused people with epilepsy to stop seizing. And now we're a little more beyond the demonic possession part, but scientists at the Mayo Clinic realized that people don't like the fast, and they created a diet called the ketogenic diet, which they realized that we can basically mimic starvation using a ketogenic diet in a way that people don't have to feel hungry. We did an earlier study looking at a ketogenic diet in Alzheimer's patients. It's a pilot study in which we ultimately recruited 15 Alzheimer's subjects. We had them on a ketogenic diet for 3 months, and the diet was supplemented by something called medium chain triglyceride oil, or MCT, which helps boost the ketosis. And the patients perform their own ketosis monitoring by monitoring their urine. There are also breathalyzers that you can use for this. And then we also track their plasma ketone levels. We perform cognitive testing at 3 points: before they initiated the diet, after 3 months on the diet, and after a 1-month washout off the diet. And we saw that there were very few side effects. The side effects were minor and temporary. The most common side effect we saw was diarrhea. And this was due to the medium chain triglyceride oil. And we were able to address it by just slowing the titration of the medium chain triglyceride oil. Most subjects complied with the diet and achieved ketosis. Now, this is not to say that most patients were able to initiate the diet. In fact, we found that when patients were fairly far along in their Alzheimer's, when they had severe Alzheimer's, the couple would have trouble initiating the diet. So for that reason, we for the TDAD study, we're focusing more on the earlier stages. These are the clinical data that we saw in that pilot study. So really, I think it was 10 of the 11 participants who were mild or moderate Alzheimer's were able to initiate the diet and were compliant with it, essentially. There was one participant, and we tracked their cognitive performance. The primary endpoint was the ADAS-KOG, the Alzheimer's Disease Assessment Scale cognitive portion, in which worsening performance or declining scores is going in this direction. Improving scores or improving performance is going in this direction. And there was one participant who, over the 3 months on the diet, lost ground. This was actually a protocol non-compliant patient or participant for reasons that aren't known to us. This person discontinued their Alzheimer's meds, their cholinesterase inhibitor, and their memantine. There's a participant who neither gained nor lost ground. But the other 8 people all showed varying degrees of improvement. In some patients, it was rather quite robust. An improvement of 6 points on the ADAS-KOG scale. I mean, that's an improvement you can see from across the room. We frequently saw this pattern in which people would, we would measure someone's baseline score, and then after 3 months on the diet, the score would improve, and then after the 1 month washout, people would revert back down to the baseline score. But we think that this improvement here after 3 months is less likely to be due to a practice effect. So, I'm just going to go through this really quickly. I won't go through these individually. There are now, if you count our study, there are 4 other studies in the literature that have looked at ketogenic diets in either MCI or Alzheimer's populations. Some of them in populations of people that studies have included subjective cognitive impairment. These are studies that tend to have somewhere between 10 and 30 participants. So they're all small studies, but they all report some degree of improvement with the diet. And this is both on clinical endpoints and on biomarker endpoints as well. And I can talk about more in the question and answer session if people like. The TDAD study is, so we're looking to enroll 80 participants, 40 of which will be enrolled to the ketogenic diet, and 40 of which will be enrolled to a diet called the Therapeutic Lifestyle Changes, or TLC diet, which is a common heart-healthy diet. And the reason why we selected this diet was we wanted a controlled diet that we can put people on to help control the study. But we wanted a diet that actually made sense for Alzheimer's, and we're all familiar with the maxim that what's good for the heart is good for the brain. So, it's one can argue that even trying a therapeutic lifestyles diet may have value for patients with Alzheimer's. Enroll 80 individuals over 5 years. Yeah, we have 5 years to enroll the 80 individuals. Not 80 individuals will be on the diet for 5 years. People, it's a short study. They're on the diet for 3 months, and then there's the 1 month washout. And that's what it says here. And yeah, our endpoints are cognitive tests, and then we have a bunch of biomarker or mechanistic markers that we're measuring. Some of them are quite sophisticated and unique to our ADRC. So we're curious about, are there going to be relationships between the depth of ketosis and clinical performance? And we're doing something that we really lead the world on, which is assessing for impact of the diet on mitochondrial activity. We're looking at whether changes in insulin signaling correspond with clinical changes. We've got some lipid homeostasis measures, so we're looking at cholesterol and things like that. But we're also looking at much more sophisticated things such as apolipoprotein E levels in the plasma, and levels of 24S hydroxycholesterol, which is produced in the brain and then secreted into the plasma. We're measuring markers of inflammation. We're even measuring total transcription data on these individuals. So, the goal is to try and determine, does this diet help people? To what extent it may help people? And so what mechanisms may be at play? The diet has certainly some unique features that I would point out. So this is a study that we're hoping to improve cognition. We know that the patients intellectually grasp that slowing of decline is fantastic, but really what they want is to be better. And so I don't know that we will or we won't. I don't know whether we will or find that this diet in this controlled fashion in a larger study improves cognition, but that's certainly our intent, is to look for that. It involves a short commitment, so people are on the diet for 3 months, and they're expected to at least be in touch with us for the month after they stop the diet, and getting all the screening and all that stuff that may take an extra two weeks too. So, but it's not a huge time commitment, and certainly, if people are thinking, maybe in 6 months I may want to, or in 12 months I may want to try a monoclonal antibody, but until then maybe I want to try a short study. This would be a good one for that. For individuals who are maybe a little bit trepidatious about taking on a medication, particularly an experimental medication. And this study does involve medications. We don't expect really anything dangerous to happen. Certainly we haven't seen that, nor has anyone else doing a ketogenic diet study. So on the relative safety scale, this is a pretty good one. Participants will receive a lot of nutrition education, which I think can only be viewed as a positive, and people tend to like. We're not looking for weight loss in this study. As a matter of fact, we try to maintain caloric intake so that people don't lose weight, but it is a fact that at least over the people in this study have lost weight. So one of our sort of big recruitment periods is right after the holidays, when people want to lose weight. So again, we're not shooting for weight loss, but that could be a consequence of this. Healthy weight loss, I should say. And that goes for the ketogenic diet and for the TLC diet. And recently, one thing that we've decided to do, given inflation and the cost of food, we've added a food subsidy. So all of those enrolled in the study will get a reasonable food subsidy during the period that they're adhering to a diet. So our regular recruitment infrastructure is a great way to funnel people to us. Jessica Keller, who's also on this presentation, she's the main coordinator of the study. And she's just an extraordinary dietitian. People love working with her. And so if there's anything that we can do to encourage referrals, we are very anxious to do that. This is not an easy study to recruit for. So I think I'm right on time. I'll stop here, and that leaves 10 minutes for discussion.
Thanks, Dr. Swerdlow. We actually I had a question come in from a provider. She asked, do you suggest, or should providers suggest that their kids do keto during exams?
Oh, so should other people in the family participate in the diet while the patient is in the trial? We've had families that have done that. We've had families that have all decided to kind of do it like as a group thing, and they've had a lot of fun doing that. If people want to join the patient in the diet, it's certainly fine with us. And some people actually do that and enjoy doing that, but it's certainly not required.
Thank you. We had another question. Do ketone supplements help in any way? She said, I am thinking they do not, but that keeps coming up with her patients.
Yeah, well, there's different kinds of ketone supplements. There are ketone body salts. You can even buy a ketone ester now. You can get ketosis just from medium chain triglyceride. And there's actually going to be a clinical trial of an MCT formulation that's going to be conducted in Europe starting in 2023. And so we're going to get more data on those approaches. But yeah, part of the thing that's complicated is we don't really know how to dose them, and and clinical data is limited. The one with the most clinical data is the medium chain triglycerides. There was a trial that was published 2 years ago called the Benefic trial, which was a trial of an MCT supplement in Alzheimer's patients, and it reported positive results. And that's the agent that's going to be tested in a clinical trial now. So, but if someone was to do, try to achieve ketosis outside the confines of the diet through a supplement, it really is a bit of a trial of one, because we haven't, these things haven't been proven or disproven, and again, we have the concern, with the issues of what's the right way to dose it, maybe a lot of this is kind of driven by the whole coconut oil story, and coconut oil, I don't know what the benefits of coconut oil are. I don't know that there's been a reliable study to address this, but if I was to try and use a ketosis therapy for Alzheimer's, I think it's kind of still in the stages where maybe it should be done within the confines of a trial. And ketogenic diet, again, goes beyond ketosis. Certainly, again, like I said, it has the impact on insulin signaling and inflammation, and may have a bigger impact on bioenergetics. Yeah. But I am encouraged to hear that certainly I'm hearing this too, that people are I think increasingly interested in the in keto therapeutics, which I think is reasonable. So one of the reasons why I'm enthusiastic about this study, and why it's a study that I think needs to be done.
Thanks, Dr. Swerdlow. We had another provider ask, what diet would you recommend to clinic patients who are having memory concerns?
Well, what we generally default to is talking about a Mediterranean diet pattern. And, we can argue about the quality of the data on Mediterranean diet patterns, but, it seems it certainly is safe. And, there is some equipoise on the efficacy, but there is some data to argue in favor of the efficacy, even though it's not definitive. But so, I'll often tell patients that. I know a lot of us do. And we tell people, obviously, to avoid, dangerous diets like overeating, or eating high fat and high carb, right? So a ketogenic diet is very different from that. Yeah. High carb, high fat is called a Western diet, and it causes people to put on weight. A ketogenic diet is very different. It really mimics starvation. It mimics caloric restriction, and at the physiologic level. It's very different from a Western diet. So, and then there's a lot of, ketogenic is kind of trendy right now. A lot of bodybuilders and or athletes use it. I don't tell my patients for either prevention or treatment in the clinic to adapt a ketogenic diet. I still think, before it gets to that point, we need more data, and that's all the more reason for doing a study like this. And there is one other, at least one other large ketogenic diet study that I know about that's being conducted, and that's being conducted at another ADRC in North Carolina. So hopefully, between that study and this study that we're doing here, we'll get that data and we'll be able to make more confident recommendations. And then also, I would add that a lot of what we're doing here, the end point of this goal is not to find that a ketogenic diet works and then have everyone in the world on a ketogenic diet. The goal here is if this helps, then we can try to figure out the mechanisms about why it helps. Then we can create drugs based around that, and then we can really get to rational keto therapeutics.
All right, thank you. In follow-up to that, she has asked, does a ketone diet help cognition in normal, healthy adults?
Yeah, that's a good question. So there are two pertinent studies that I know about. So one was very small, and it wasn't necessarily perfectly normal people. It was people who had subjective cognitive complaints that were below the threshold of detection on exam. So what we call subjective cognitive decline. And in that study, the people with subjective cognitive decline appeared to have some benefit in cognition. But so that's the closest direct study. The other study that's relevant was a study that was published about 10 years ago. It was done in Europe, and it wasn't a ketogenic diet study or a ketone supplement study. It was a caloric restriction study. And the study took a bunch of middle-aged people, young to middle-aged people with normal cognition, and half of them, or a third of them, just ate their normal diets. And then there was 1/3 went on to some other diet. I can't quite, a heart healthy diet, and 1/3 went on to a caloric restricted diet. And now the caloric restricted patients were almost certainly in ketosis. And what the study reported was that those who were on the calorically restricted diet showed improvements on their memory test scores, on their cognitive testing, which weren't apparent in the other diet arms. So yeah, that's the most direct data that I'm aware of. Although this wasn't it wasn't a ketogenic diet. It was a calorically restricted diet that almost certainly caused ketosis, but ketosis levels weren't measured in that study.
Wonderful, thank you. I don't have any other questions in the chat at this time. If you would like to ask any questions for Dr. Swerdlow, we are at time, so you're welcome to unmute and ask them now quickly, or you can send them to me and I can make sure that we get those questions answered. All right, looks like no further questions. So thank you, Dr. Swerdlow.
Okay.
Thank you everyone for joining us this year. Go ahead.
Yeah, I was just going to thank everyone for their attention. Thanks.